Hey guys, welcome back to another episode of Keeping Up with the Diseases. Ooh, that was a bad one. I wonder who's coughing so badly. Is it you? It's definitely not me. It must be that patient who has just entered my room. Let me introduce you to him. His name is Robert Chan, also known as Bob. He's a 42-year-old married businessman who was diagnosed with diabetes at the age of 35. Oh, it seems like he's here with his wife as well. Let's have a quick chat with him. Hello, nice to meet you, Bob. What brings you here today? Bob, answer him. We're only here to help you. What? I told you I don't want to see doctor.
One eternity later.
Fine, doctor. I've been coughing a lot lately, but I think it's normal fever. I see. When did the coughing start? 2 weeks ago after I came home from business trip to China. I see. Has the coughing gotten worse over the last 2 weeks? I think all okay only lah. That's not true, doctor. He coughed blood yesterday. Bob, please understand that your condition may be severe. It is okay for you to share with me. Have you noticed anything else? I've been feeling really tired lately lah. I've also been sweating a lot when I sleep at night. China? Long coughs? Blood? Fatigue? Night sweats? Alright, Bob. Thanks for opening up to me. Can I run some tests now? Do I have to? Okay then. So, with all this information in mind, what's your diagnosis? If you said tuberculosis, you are spot on. Tuberculosis is a severe infectious disease that usually affects the lungs. Differentials for tuberculosis include chronic bronchitis, chronic obstructive pulmonary disease, and cystic fibrosis. Tuberculosis is caused by a bacterium known as Mycobacterium tuberculosis. What's so special about this bacteria, you might ask? Well, the Mycobacterium tuberculosis contains a special compound known as mycolic acid, which is present in its cell wall. Because of this mycolic acid, the Mycobacterium tuberculosis cannot be detected using a Gram stain alone. Instead, a ziehl-neelsen's acid-fast stain is used to help in the clinical diagnosis of tuberculosis. When this bacteria is exposed to the acid-fast stain, the mycolic acid present in the cell wall of the bacterium will cause the bacterium to be stained red, indicating the presence of the Mycobacterium tuberculosis bacterium. Mycobacterium tuberculosis can be present in two states, active and latent states. We need to inform you that tuberculosis lasts over 6 months. And because of that, tuberculosis is considered a chronic disease. There are several tests that can be done on asymptomatic patients. One of the main tests is known as the tuberculin mantle skin test. What this test does is it detects the presence of tuberculin proteins in the patient. If there is a presence of tuberculin proteins, a red hard nodule will be formed on the skin. This test is useful in determining if the patient is previously or currently infected with the tuberculosis bacterium. Another test is the interferon gamma release assay, which detects the presence of the tuberculin proteins in the blood. This test is way more specific and is usually performed in a laboratory environment. The interferon gamma release assay helps in detecting patients only if they are currently infected with the tuberculosis bacterium. For symptomatic patients, a bronchoscopy is usually used, followed by staining, culture, and PCR. Mycobacterium tuberculosis colonies are usually yellow in color, and they grow in clumps, as you can see in this agar jelly. There are several factors that put you at risk for getting infected with tuberculosis. The first one is travel history to a country that has high incidence of tuberculosis. Lab workers who deal with microorganisms on a daily basis may also have a high risk of being infected by tuberculosis bacterium. Injection drug users are also at a high risk of getting infected by tuberculosis. Furthermore, patients with pre-existing conditions like diabetes, alcoholism, and HIV are also at a high risk of getting infected by the tuberculosis bacterium. There are several key clinical features that patients infected with TB will display. These include fever, night sweat, flu, coughing, hemoptysis, weight loss, anorexia, and loss of appetite. Let's check out the pathogenesis of the bacterium. As you know, tuberculosis infects the lungs. First, the bacterium will enter the upper respiratory tract and enters the trachea before entering the bronchi. Once it enters the bronchi, it will start to infect the lungs. Fortunately, cute cells like alveolar macrophages will help the body to defend against this infection. As you can see, this alveolar macrophage has noticed the presence of the Mycobacterium tuberculosis, so it proceeds to phagocytose it. The alveolar macrophage contains lysosomes, which contains hydrolytic enzymes, which helps in the breakdown of this Mycobacterium tuberculosis. In order for the enzymes to break down the bacterium, a phagolysosome has to be formed. But the tuberculosis uses the anti-lysosome fusion technique.
Say what?
Which prevents the phagolysosome from being formed. This is where the bacterium begins to replicate itself inside the alveolar macrophage. And this process happens until the alveolar macrophage can handle it no more, leading to apoptosis and allowing the bacteria to spread throughout the extracellular matrix. Oh, it seems like Bob's results are back. Let's check it out. Your results are back, Bob. All good? Unfortunately, you have a primary TB infection. I guess that's okay lah. Tuberculosis is a serious notifiable disease. If not treated well, it can be life-threatening, Bob. So there are two main types of TB, primary TB and secondary TB, which is dependent on your body's immune response. Primary TB usually happens during an infection, whereas a secondary TB happens during a reactivation of a latent TB. Patients diagnosed with primary TB will display signs of infection after exposure, and this period is the most asymptomatic stage, where the patients will only display mild flu-like symptoms. Patients with primary TB will experience cell-mediated immunity for 3 weeks. During these 3 weeks, a granuloma will form. A granuloma is formed when white blood cells surround a bacteria to prevent it from spreading. As you can see, there are many different cells here surrounding the Mycobacterium tuberculosis, which is present in the center of the granuloma. This granuloma is encapsulated by a fibrous capsule to prevent the Mycobacterium from spreading. When we look at an X-ray of a patient with primary TB, we would notice that there are a few white splotches here and there, and these are known as the Gowan focus. Also, because there's so much immune response going on, the presence of caseous necrosis will be prevalent in patients with primary TB. The Gowan focus plus the caseous necrosis will form the Gowan complex, which can be found at the mid or lower lobes of the lungs. After the body manages to fight off the primary TB, Runcke complexes will be formed. Runcke complexes are formed when fibrosis and calcification form scar tissue in the lungs. At the end of the day, most TB are killed off, but some stays latent. How will they be reactivated, you might ask? When a patient has immunosuppression, which means a weak immune system, either due to AIDS or old age or other factors, the latent bacterium hiding in the granuloma will suddenly become active. This is because when a patient experiences immunosuppression, the number of white blood cells will decrease. Upon reactivation of the latent tuberculosis bacterium, memory T cells will begin to fire antibodies, creating an immune response in the patients. Because of this, when we take a look at the X-ray, we will notice that there is way more caseous necrosis, leading to something known as bronchopneumonia. So Bob, it is good that your wife brought you in early, because your conditions are not so severe yet. Oh, not severe ah. So can go home lah.
Oh, hell no!
Bob, we need to get you treated immediately on meds. Can't I just take my herbal tea instead? I like natural one ma.
Bruh.
Bob, please understand that tuberculosis is life-threatening if not treated with the right medication. Herbal tea will not be helpful in killing off the infection. If left untreated, there would be many health complications in the future. Some of the complications include pyuria, which is the presence of white blood cell in the urine, Pott's disease, which involves the vertebral column, Addison's disease, where your adrenal glands no longer produce enough cortisol, meningitis, which is the infection of the meninges in the brain, cervical lymphadenitis, and hepatitis because of the bacterium. Okay lah. What do I need to take? Well, basically, for patients with latent tuberculosis, isoniazid for 9 months should do the trick. But for you, Bob, you might have to undergo the RIPE medication. RIPE is a mnemonic for rifampicin, isoniazid, pyrazinamide, and ethambutol. So Bob, we should start treatment as soon as possible. it is expected to take you at least 6 months to recover. Ayo, I go work lah. Bob, your health matters more. Also, it is important to quarantine and avoid infecting others. I recommend running tests on those exposed to, such as your wife and kids. My kids all staying far, no worry, doctor. Alright, then I recommend that your family gets vaccinated against TB.
What?
Hey, cannot. I don't like all these chemicals in my body. Bob, I understand your concerns, but allow me to explain how the vaccination works. You see that lump on my left arm? Well, this lump over here indicates that I've taken the BCG vaccine, which is the vaccine for tuberculosis. Inside this vaccine is the presence of attenuated TB, which are weakened Mycobacterium tuberculosis. BCG is an intradermal injection, and there are 2 doses that people should take. One at birth and a booster shot when they are 7 or 12 years old. Oh, if like that, then it can protect my family, is it? Yes. Okay lah, Bibi. You want to ask our boy or girl come and take jab or not? I WhatsApp them first lah. I tell you later, doctor. Okay, please let me know as soon as possible.